Welcome back to All Future Guys. Dr. Ben Benulis here. Want to share another video. I did an interview with Dr. Kasey Johnson. She interviewed me for Unlock Wellness podcast, which you haven't checked it out yet. It's awesome. This is our second video episode, and this time we talk about the American healthcare system. And just wanted to give you my spin on it before I cut to the video. But essentially, we're in a situation with a healthcare crisis where everybody thinks it's healthcare is too expensive and that we don't have the money to pay for it, and that people are dying because they can't afford care. But the real fact is that people are dying whether they can afford care or not, because the care doesn't work too well, because it essentially tries to treat the symptoms instead of the root cause. And so we spend a whole bunch of money, get terrible results. And so the healthcare crisis is not going to be fixed by throwing more money at the problem or trying to make care cheaper or drugs cheaper when the care doesn't even really get people better. It's about diet and lifestyle, and have the biggest impact on the diseases that we spend the most money on and lose the most people to every year. So I hope you guys enjoy this video, get a lot out of it, and feel free to give it a thumbs up, comment, and subscribe to my channel on YouTube if you haven't already. And without further ado, let's get to the podcast.
Everybody, I'm Dr. Kasey Johnson. I'm here again with my friend Dr. Ben. How's it going, Dr. Ben?
Having a good day.
Awesome.
Good to be here.
Do you want to introduce yourself?
Sure. I'm Dr. Benjamin Benulis. I'm a chiropractor in private practice in Berkeley, California, plant-based physician. And what else do I say?
That's good enough.
Wellness advocate.
There you go. Awesome.
I feel like these titles people throw out are just completely arbitrary. I'm just in it to help people and spread good information. So
absolutely awesome.
Yeah, let's do it.
Yeah. So Dr. Ben and I we were trying to figure out exactly how we were going to go with this topic today, but we were going to jump into the different healthcare plans that are kind of being debated right now, and just our opinion on where we think the focus should be on. So Dr. Ben, do you want to just jump in at first and just talk about just some of your basic opinions on what's going back and forth with the different healthcare plans right now?
Yeah, sure. So, I mean, we essentially have, because in America it's a two-party system, we have, the good guys and the bad guys. And those are pretty much arbitrary based on what major news media outlet you watch, right? So, one group wants, the Affordable Care Act, and one group wants, something else that changes here and there. It's like, we know healthcare the system is not working. And so politicians in Washington is, doing what they can to try to regulate things and to try to bring the costs down, make it fair. And people, there's a health crisis in America, and they're trying to do something about it. But honestly, they don't really understand how health works. And so anything that they mandate is already within an existing paradigm that's broken. So I don't really see us getting a lot of help either way.
Right. I mean, like you were saying, we're in a state right now where we have more sickness, more obesity, more medications than ever. So obviously what we're doing right now is not working. And it's not necessarily a healthcare system right now. It's a sick care system. So I think we need to get down to what needs to change. And I mean, obviously almost every single one of these diseases aren't genetic, they're lifestyle. And there's a lot of research that proves that. So, I mean, we need to really be diving into just lifestyle and how we can really just avoid the sickness altogether.
Yeah. Yeah. And a lot of people will say, oh, people don't want that. Well, I mean, the reality is, like, that's the best way to do it. It's the most economical way to do it. And we know that healthcare spend is out of control. I think in this country, we're number one in healthcare spend of any other country in the world, and don't have really good results to show for it. So a prevention model is really key. And so it's like, if you're in the hospital, but then it's too late to have it prevented.